Injury hacking traps to avoid. Hey, I'm Sarah from mostmotion, and I'm here with another episode of how to hack injuries for every sports and fitness coach who wants to help their athletes, clients, group members to avoid injury without getting too technical about it. So, what are the traps that we're talking about today? Well, there's three. The first one is language and the terminology that we use when it comes to injuries themselves. Now, the reason this is a trap is because when it comes to helping prevent injuries and non-specialist coaches getting involved in that, if we focus on the terminology itself, it creates a very technical aspect to what we're trying to do, and it gives us the idea that we're trying to help with specific injuries, which is not our responsibility. So we need to be thinking about the terminology used around specific symptoms or specific injuries themselves as literally just where a patient would point if they were trying to describe it to you. So let's say, for example, you had IT band syndrome or patellar tendonitis or something like that around the knee, then you would know exactly where IT band syndrome, that is exactly where the client would point. Okay, it'd be the outside of the knee, that's where it hurts, that's all you need to know. It doesn't really have any bearing on what you're going to do about that, because the pain is not your responsibility. Okay, and that brings me to my second point, which is that most therapists and the standard industry practice is to focus on the area of pain. But like I said, pain is not your responsibility as a non-specialist, non-injury specialist coach. So if the standard treatment protocol, which is not your responsibility, is to focus on the area of pain, then as an injury hacker, i.e. somebody who is a non-injury specialist coach, for your job, you can focus on the furthest point away from that area of pain. Okay, how does this work? Well, if you're sitting down, I'm sitting down now, I'm rolling around on my fitness ball. If I turn my head to look behind me, okay, I can feel my opposite foot push into the floor, which means that the simple act of turning my head is influencing everything further down my body. So if you have clients with knee pain, for example, then you can do lots and lots of movements in the upper body that will influence and help to take the strain away from that knee without getting involved in the knee itself. So the third thing is that we tend to blame external factors for the reason that the client had the injury in the first place. But again, it is not your job to establish the cause of the problem unless your training practices were part of it. Okay, essentially, injuries happen because there's a joint restriction somewhere in the body. Yes, external factors will play a small part on top of that, but if those joint restrictions weren't there, the external factors wouldn't be so much of a problem. So if you know that injuries happen because of a joint restriction somewhere in the body, it doesn't matter whereabouts that is. You can include multi-directional movement into every session, so multi-directional joint movement into every session, and that way you can help relieve the strain on the areas of the body that are causing problems, and that way you can help to reduce the pain without getting involved. So, to summarize, you can firstly acknowledge that the label of the syndrome or the itis or whatever it is, the diagnosis that's been given around that pain is literally just where to point to acknowledge where the pain is. It's just describing where the pain is. It's nothing to do with you, okay? The second thing is you can start to improve the movement around the areas furthest away from the body, and you would still have a positive impact on what's going on with the injury itself. And the third thing is you to include multi-directional joint movement in every session, and you may notice just from that little checklist there that it doesn't matter whether your client is in pain or not. Okay, this is a really powerful thing about injury hacking. A slight bonus tip for you. It doesn't matter whether your clients are in pain or not. Your approach is exactly the same. So, non-painful movement, non-painful multi-directional movement specifically in areas away from the point of pain, and you can help lots and lots of people to reduce the pain that they're in and also to prevent pain coming in the first place. So, I have a framework that is outlining exactly how this works, so you can get all the details that you want. I'll give you the exact strategies that I use at each step of the framework. You can get that absolutely free. I call it the Injury Hacker Solution to Knee Pain. I'll put the link in the comments below, and then you will be given the opportunity once you ask for that framework training. You'll be given the opportunity to dive deeper into certain aspects of that framework, see them in action, get coaches education industry standard approved coaches education training around it, and also you will get the opportunity to get my specific movements that I have sent every single client of mine to without fail, and it's always improved their movement. It's always improved their feeling of pain as well. So you get the opportunity to get access to all of that just through that link that I will put in the comments below. And don't forget, if you like this video, click the likes, click the hearts, share it with your friends, tell other people about it. And of course, if you want to come and join us in the Facebook group, then you can do that at injuryhackers.com. Thanks for watching, and I'll see you again next time.